All right, and we are live. Happy July 31st, everybody. We're here today to talk a little bit about how Copilot is being used inside of the health and life sciences market. In particular, today we're going to focus a little bit around how Copilot is being used for our payer customers, so our health insurance clients, and how this is something that can be relevant for a lot of different use cases, but we're really going to double click on sales and sales related endeavors. So, quick introductions of the team. My name is Jeremy Dollar, and I am a technical specialist here at Microsoft. I've been very hands-on with our Copilot solutions for sales use cases now for about 2 years, and really helping our customers and our market understand how this drives and creates value and shows them a whole new way of working every day, whether it's for an agent or a broker or even a kind of a digital self-service agent perspective.
I'll jump in there. Uh, I am Fujiro Kiyama. I am a business applications executive here at Microsoft. I am focused solely on our payers within our majors division. So our large scale payers across the organization. And really my job is to better understand the situations, the pressure, the trends that are really transpiring within the market, and then really speak to the ways that we're able to align the technology, not only to just show you something cool or show you a neat feature here or two, but really the ways that it makes your life and the life of your employees, your members, and the ways that you bring it all together a bit easier. So I always say Jeremy is my technical conscience. So when we get into the conversation, he's always pulling me back into where it goes. But we love having these conversations, and really excited to have that conversation today.
Hi, everyone. I'll go next. My name is Ashley Kaimak. Excuse me. I'm also a business applications specialist. And prior to joining Microsoft, and a couple of years even before I worked in software in general, I actually worked as a Medicare Advantage seller. So it's really cool now to work with some of our strategic provider and payer accounts at Microsoft who have Medicare Advantage plans. Because if I had some of these tools back then, man, it would have been a world of a difference. So I'm so excited to talk to you guys all about how we can help empower our Medicare Advantage teams with the tools that they need to be effective.
Yeah, hello everyone. My name's Chad Stout. I'm a recently ordained Copilot technical specialist here at Microsoft. I've been working with the product for over a year and a half now. I was lucky enough to be an early adopter inside of Microsoft, and boy, have I learned a lot. I've learned a lot about how this has helped me personally gain productivity, take some of the drudgery out of what I do day to day, and honestly really dig in deeply, especially with our early adopter participants, really dive in deeply with payers and providers on how can Copilot for M365 as a more general productivity enhancing assistant benefit individuals in specific roles in both the provider and the payer space.
Absolutely. So again, this is a pretty good time to tee it up, but again, we're going to talk about various use cases that we are seeing in the market, problems that our customers are tackling. And so when I think about Copilot for payers, there's a lot of great use cases and scenarios, and we're really just biting off one chunk of this today, and we're talking about those sales related use cases. So for me, when I'm talking to customers, I've talked to them in detail about scenarios like digital brokers or a assistant for a broker or an agent. I've also spoken with payer customers, quite a few of them, that have a PBM or pharmacy benefits management kind of arm underneath their organization, and how this can help that PBM, say account manager, make sure to renew and retain their clients. So what else are you all seeing in the market in terms of those sales related use cases? What are customers looking to solve? What business problems are they tackling?
Well, I'll jump in there, Jeremy. I think Ashley already nailed it, and it's going to be great to talk through both sides. But when we talk about the changes, I think in like the regulatory aspect around the star scores, around Medicare Advantage, and having those adjustment models which affect kind of like the risk reimbursement and the operational margins across for our payers. With those changing in the market, we have to find ways to arm them to have the ability to really give their agents the tools, and I think the ability to better know their members, better to relate to them, to take advantage of what's going on in the market. And I think that's one of the ones we're seeing at the forefront. And I love that Ashley brought it up, especially with her work in doing that actual job on a day-to-day basis. So I'm sure there's more color she can add there.
Yeah, and I'm so glad you brought that up, because everything you're talking about that's happening at a macro level is really impacting Medicare Advantage plans and Medicare in general. They're under a lot more financial strain. And so to try to curtail that so that the customer is not on the end of having increased premiums, a lot of the time what happens is these plans have to take away benefits. And so suddenly, during annual enrollment period, there's already going to be a lot of people who are shopping around trying to figure out if this plan works for them or not. But because of those changes that are impacting the benefits these plans can have, is causing a bigger influx of people who are shopping and potentially looking to leave their plan. And so it creates a unique opportunity where you can really capture more market share by people who are looking to leave, but you also have to steward the people that you do have. And so sellers have to do essentially more with way less time. And so the importance of having tools that can increase their productivity and make those conversations more meaningful to increase that market share and keep the people that they already have is going to be critical for success.
Couldn't agree more with you, Ashley. I'm working with a payer. Actually, I've worked with this payer for, I think I'm going on my 4th year now. They have Medicare sales representatives as part of their Medicare and retirement division. During that open enrollment period, when it's critical, right, that people are engaging, they're collaborating with not only existing customers, but potential customers or prospective customers. It's important more than ever, I would say, that they're equipped with the tools, right, to take some of the drudgery out of that work and give them time to engage more frequently and more often, more broadly with a large, base of customers or potential customers.
Mm-hmm.
And Chad, that's spot on, because I think the market for Medicare Advantage, is saturated, right? Everybody is looking to get a piece of that market share, and there's such a short time frame that everybody can really have the opportunity to actually go out and recruit not only new members, but to your point, you're recruiting the members that you had last year too. It's that constant competition. And so finding ways to give the agents a leg up, right? A little bit more of an advantage as it pertains to better understanding what's going on and maybe speaking more in kind, right? Really increasing those levels of personalization and really diving heavily into ways that we can be more one-to-one with our members. I think that is the way that organizations, at least the ones I'm talking with, are thinking about the ways of being able to make an impact and stand out in such a crowded field.
So, Chad, I'd like to double click on a little bit of that. Tell me a little bit more about when you're talking to your customers, especially your payer customers, maybe talking about use cases, business problems, or things that they're looking to do for their reps, their agents, et cetera, their sales related motions. What does that actually look like? What are we helping them with?
Well, I think number one, right, like we're all dealing with this, but more so, I think, in the healthcare space, whether it's a payer or provider, right, we've got information overload. And in the case of the medical sales rep or Medicare sales representative that I mentioned prior, right, their inbox is inundated, right, with prospective clients, existing clients, right, that have questions about coverage and other inquiries. They're kind of the frontline face, and they're the first person, right, with a potential or a prospective candidate that person interfaces with. So they kind of remain sticky from a relationship perspective. So then how do you scale that, right? How do you scale that inbox, for example? How do I keep track of the conversations that I've had with, right, with those clients, with those customers? And in a lot of cases, right, I can use, and we've ran into this with customers. They're finding really simple Copilot for Microsoft 365 capabilities are bringing pretty impactful savings in time.
Now, this is something that I think that maybe seeing a little bit of that is something that really helps illustrate that. Chad, do you want me to bring up an example of Outlook, or do you have one ready to roll?
I've got one ready to roll if you want to take a quick look.
Yeah, I would love to see that.
Awesome. So I'm just going to bring this. I'm in my demonstration tenant, of course, here, but I've got a long, lengthy email thread, right? It's a collaboration between the Medicare sales representative and a prospective client. And this is a pretty long thread, and I haven't talked to Chad in a week or so, right? Because I'm filing through these things, trying to set up meetings. I know this meeting is coming up, right? And so I need to reorient myself to the conversation so that I can prepare for the discussion and then, prepare for a presentation based on what Chad's interested in here. So I'm just going to click summary by Copilot. And you see here that it went through that lengthy thread and essentially outlined the fact that I reached out to Chad to offer assistance in finding some Medicare plans to fit his needs. Chad agreed to have a meeting on Friday and asked specifically about some prescription drug coverage and additional benefits. And then I confirmed a meeting for Friday at 8 a.m. So now, essentially, I need to get my head around preparing for that meeting. But that's a simple example of how, I can really quickly save maybe not a huge amount of time, but a few minutes in reorienting myself to the conversation that I had with Chad.
And
that's pretty awesome.
Can I add one thing just really quickly? Because I really want people to understand how significant this actually is. So when I was a Medicare seller, I worked as a captive agent, which just meant I only represented one plan. So I can't even imagine brokers who had to remember all sorts of plans. But often my day would look like I would have various presentations throughout the day where you're meeting with a plethora of prospective beneficiaries, and they're asking you very detailed questions. They're not asking, oh, what's the difference between this doctor and that doctor? They're asking you, is this drug covered? What if I have this complicated surgery? What if I split my time between Florida and Michigan, where I was at? And so they can be very complicated and specific and detailed. And you have to get all that information, somehow remember it, also understand the differences on the region of the plan, all in probably 5 minutes. You can't call them back because of regulation. So if you're not accurately putting this information down, you're not going to be able to accurately answer those questions and remember what they need answered. And then all in the context of you got to make it to your next presentation, which is probably down the road or down to the next city. And so if I had a tool that could help recall all of that information in live time, it would be a game changer. And that was a normal AEP. I couldn't even imagine what agents are having to deal with now in terms of their time really being cut down. It's ridiculous to ask agents to remember everything in their head. They need the technology, they need the tools so that they can answer these questions that are, by the way, very, very meaningful to the people that are asking them. And so, Chad, I'm so grateful that you showed that because it's very, very important.
Ashley, I also had a question for you. I mean, I think about how complex that is end to end, right? I'd be curious to know how many systems like you are looking in to pull all that information together, right? Where you're talking about having to turn here and grab that and then turn here. And I can only imagine how strenuous that is, especially with the time constraint. And then trying to jump in between all these systems to gather enough information to provide you like a holistic picture to have the conversation. So I'd be curious how that was that in when you were in.
It was challenging and shockingly, and I think a lot of different plans might be under the same type of, they might be dealing with the same issue in that a lot of this was paper-based. And so we often had these huge booklets of all the information in our plan. Yes, we had some sort of online technologies that could help us, but they were all disparate. There was no unity. And so you're pulling from manual documents, you're looking for things online, you're trying to remember your notes and your CRM. It was crazy difficult. And so often what we end up doing is we'll take a paper and a pen and we'll write down as much as we could and then try to remember when we go back to our office. And so if I had a tool like Copilot, that could pull that information, that could help me remember those important details, it would really save a lot of time, a lot of time.
So there's a few things that I'm thinking here, and Chad, I'm gonna probably show just one thing really quick, and then I want to hand it over to you as well. But Copilot is awesome for sourcing knowledge and information. And here's just a super quick example. This is something that we do here at Microsoft just all the time, right? So what I did is, and you can say I just did this a minute ago. But say I'm say an insurance rep, and I'm trying to figure out, all right, well, what's new in this document, or what services are covered, right? This is a high level example, but essentially what I'm saying is, help me Copilot understand what's in this plan. And it could have been a more pointed question. The more detailed that document is, the more robust that answer could have been. It could have been, tell me about the co-insurance for colonoscopy. Right? It could be really detailed if the document has that type of information, and it's coming through and it's helping me get to that level set of details. It's helping me summarize, and this is just a high level example. I could have gone way deeper, but Chad, I want to make sure that you show what you're seeing in your market as well.
Yeah, sure thing. Actually, it fits right along the same lines, Jeremy. I mean, the importance, right, of I think we overdo it when we call it prompt engineering, right? Because it's really just the conversation between a human being and a machine, which may be a little bit odd, right? You have to get used to that a bit. But it's like having a conversation with your kid, right? Or having a conversation with your colleague, right? That has some knowledge about a specific topic, right? So the importance of grounding, right, in that topic, finding the right person to talk to and have a reasonable conversation with, is pretty important, right? And you showed a good example of that. I'm going to carry on with that example, and we're going to go back to Billy, right, the representative, the Medicare sales representative, and we're going to see if he can quickly put together kind of an outline, right, for a conversation and a presentation with Chad on Friday. So you can see I've jumped over here into Word, and I've actually kind of pre-prompted this, right? So Billy's got some time scheduled to focus on prospecting and lead generation, but because of the message from Chad, right, in that interaction, he's going to use this time to prepare for the meeting on Friday. Since it's his first 30-minute engagement with Chad, he needs to consolidate the messaging, right? He's got plenty of marketing content, but he really wants to consolidate the messaging and make sure he gets some of Chad's initial questions out of the way right away. So I'm going to just cut and paste a prompt in here. And again, right, we talked a little bit about the importance of grounding. And I know there's a document I want to ground on here. So give me just a second. I am going to ground on a specific piece of content that I know is out there. I've got a PDF, Medicare Made Clear, getting started. So I'm going to start by asking Copilot to help me summarize this lengthy PDF. We're going to give it a few seconds. Usually Copilot, well, if it's in the morning, I feel like Copilot needs a cup of coffee. He usually comes back a little later. But in this case, he's been pretty quick today, and here we go. So this is a summary of a really long PDF. And again, right, I only have 30 minutes to have this conversation with Chad. It's my first time meeting with Chad. I need to make a good impression. So it's going to come up here with a summary based on information in that document. And again, Chad had asked something very specific about prescription drug coverage. And I see a lot about Medicare plan here, but I don't see much about prescription drug coverage. I like how this has started out though, so I'm going to keep it. And then I'm going to get a little bit more specific, and I'm going to ask Copilot, hey, can you summarize the information on prescription drug coverage? We've already grounded in the document, so let's see how Copilot comes back.
Chad, what
Right.
I love about that is that it's continuously having that dialogue back and forth, right? It's not just stopping with one and saying, okay, well, this is great. You did a summary, but can you also highlight this additional set and drill into that a little bit further?
Exactly. And let's see, it came back with some information. Looks like it may do a better job if I reground it. But we're going to keep that. And I'm gonna actually prompt a third time and say, hey, Copilot, really excellent. Thank you for the summaries. Can you help me create a 30-minute agenda based on, and we're going to ground it again, information found in Medicare aid. So what's actually helping us here, this / is something Microsoft calls IntelliSense. So we can / in our prompt to pull documents that we have access to via the Microsoft Graph. And in this case, Billy has access to Medicare Made Clear. So we're going to ground it again, and we're going to see how Copilot comes back. I do demos a lot, and I get teased a little bit because everybody says I'm pretty nice to my Copilot. Well, I want to be super nice to my Copilot because it helps me, right? Like, I feel like if I'm nice, I get better answers back.
Isn't that the way the world works, Chad?
I think so, right? That's the way I live my life. So why wouldn't I have the same type of courtesies to a machine? They're doing a lot of work for me.
That's super fun.
So it's coming through the document again. It may take a little bit of time. There we go. All right. So we've got a good agenda here that we can potentially just cut and paste into a meeting invite, and this will give Chad a good indication as to what we're gonna talk about.
No, this is awesome, Chad. Seeing this live is exactly what they need. And being able to summarize those extensive documents and those very detailed, intricate plan summaries is very beneficial, I think, in setting, not only educating the member, right, but helping us compete right in that market. And I think if we take it a level up, I was going to ask Ashley, I mean, how often were you in competition with another plan and you would have a member bring up, hey, I'm looking at this plan over here in comparison to yours. What knowledge do you have, or what kind of information or insight can you provide pertaining to that? I'd be curious to know how often that came across and what you had to do to handle it while you were in that role now. And then I could see ways that Copilot could come in and aid in that process.
Yeah, I mean, that's a common question that I don't think there has ever been a beneficiary that I spoke to, at least if my memory serves me right, that isn't asking a question that's predicated on how it compares to something else. Like what we have to realize is that there are a lot of regulations on how plans can market to this population of people, but during AEP, it's like a fire hose to your face. So these prospective beneficiaries are getting bombarded with ads on their TV, ads on the internet, ads, on the radio. They get mailers from different plans. I mean, they're getting just an onslaught for 3 months nonstop. And so often as an agent, you're not only having to filter through how does your plan compare, you're also having to filter through those minute changes, excuse me, from region to region. So my plan, for example, we had 3 different plans that had small differences based on the region of the customer. And so I had to filter through that and how it compares to maybe more national plans, excuse me. And so it's a lot of information to remember on top of the fact that you are largely educating a whole new system to people. We had, prospective beneficiaries that were aging into Medicare and had no idea what any of this meant. And suddenly now the clock is ticking and they have 20 plans that just contacted them, via ads in the last week that they're trying to get an answer to. And so you have to do a lot of educating on Medicare as a whole, and then also filtering through, okay, what region do you live in and what benefits do you actually get because of this region? And how does that compare to all these other plans? It's a lot to keep in your head. And so not, having a tool like this where you can kind of filter and consolidate that information more easily, man, it would just make I know if I were in that job with these tools, my conversations would be much more efficient, but also more meaningful, because it doesn't feel good when you have someone there asking a question that's so meaningful, like their health coverage, and not be able to have an answer. It feels awful. So tools like this would be very, very useful.
Ashley, how about something like this? How about using Copilot to build your competitor comparison matrices? How would that have helped you?
That's it. I'm
Good job.
quitting. I'm going back to selling Medicare. Honestly, so my plan too, when I sold this, we had to find stuff like this online, and it was a hassle. So having something like this where I could show my customer, man, game changer.
Yeah. So, and I've got a follow-up question there. So, how often was your competitive intel information accurate or up to date?
Yeah, I would have to guess it would be a large margin of error, just because we were dependent on what we can find online, and there was no way to determine if those sources were updated from year to year. And so yeah, it wasn't always the best way to go about it, I would say.
Yeah, yeah, absolutely. So, one thing that is possible, just to give you two compare and contrast examples, is that say if you have your internal documentation, you can ask Copilot to provide that information, look for a specific item, and those are the types of things that Chad and I have been showing. But the other thing that you can do is, and we're not intending to pick on anybody in particular, but you can, for example, ask Copilot for information based off of the web. So just to kind of pick out some random ones, how does the Medicare Advantage plan compare for, I don't know, let's just say Humana and Aetna? Provide details on the coverage offered in the state of Georgia. Right. So something like this, I mean, what this will do is that even if you don't have information to reference internally to your own organization, right, because there's a lot, right? Especially when all this information is getting updated for that annual enrollment period, there's got to be way more than any competitive intel team can keep up on in a timely manner. But Copilot is able to then go out and source this information in real time from the web. Of course, when you do that, you're going to want to essentially provide that hands-on look of that, right? There's a human in the loop. So I want to make sure that it's providing that information. Maybe I could have been more specific in my prompt by saying for the 2024 plan year, or the 2025 year. But this is already providing some great information, and I can do things like continue to fine tune this. So I could have said, make this shorter, make it into bullet points. But say if I wanted to take all this information, especially kind of these elements here, I can also ask Copilot to auto rewrite this or to change it, or even visualize information as a table. That's what I've done a few times throughout this document. That's a really great feature, because especially if you're a rep and you're going to be maybe even referencing this during the call, a blob of text isn't going to be the easiest thing to hunt and peck through. So you are able to then use Copilot to completely reformat these things. This is something that would have taken to break this apart and turn into a table and have it kind of thoroughly analyzed and put it into something essentially like this. That would have been an hour at least, or maybe would have
At
never gotten
least.
done.
Yeah,
Yeah.
exactly.
I think
And
it's
this
more
is spot
likely
on
that it
why I
would have
call
been.
Jeremy my technical conscience right here. That is ideal in showing it, right? It all comes together using the technology and being able to not only ground it in your data organizationally, but that extra piece is being able to step out and do some of that research and the work for you. I mean, I can only imagine how much time it is to bring all of this together and get all of the right information and coalesce it all into a document. But then in turn, to Ashley's point of trying to enhance the client engagement, you've done all this work now and you're talking to the customers on it. But now it's almost like you're just heavily focused on that. Like, how can we, take it a leg up? Because I'm sure, Ashley, you were diving into trying to remember as much as you could from the conversation, then trying to then transpose that back into the CRM system. And let's be honest, not everything sticks as well as it should, right? So maybe some things fall through the crack. And how were you able to try to, I think increase that personalization and that engagement from a member perspective, but also still make sure that like the information that you need to continue moving them down the line with your Medicare Advantage plan was still in the system so that you could still stay on top of that level of personalization.
Yeah, absolutely. And just
Ashley,
go ahead. You're
well,
fine.
I was wondering, how often were you asked to log information into CRM?
So like every seller, we're asked to log more than we actually do. But what made it even more difficult for me is being on the road. And so it just wasn't easy to do it. It wasn't intuitive. And so then I just went back to paper methods and just wrote everything on paper. But certainly I needed to update as much as possible to just track every conversation and, where we left off with the customer.
So Copilot is available on mobile as well. Gosh, we could do an entire different day,
Oh my
different meeting
gosh.
on mobile. That would have been a lot of fun. But one of the things to think about as well, and when we've been talking about this, we've been talking about sourcing data that's in M365, data that's on the web, but your CRM data, that's important too. Right. So one thing that you're able to do with Copilot is you're able to prompt it. So you're able to draft with Copilot, and instead of just referencing a file or a document or just sourcing from web data, you're also able to reference CRM information. So you're able to say, help me prepare for a meeting that I have with a prospect that hopefully will become a member this year. And that's what we did. We said, all right, I've got a meeting on my calendar with Marcy. She's a contact inside of my CRM. Help me get ready for this upcoming calendar meeting. And it said, I've got all this information for you. I have the information on their account from Salesforce. I know exactly when this meeting is occurring. And did Marcy even RSVP yet? Need to probably ask Marcy what's going on, right? Make sure that she got the invite. And then it's also able to then bring in more CRM information into the process too. So saying, all right, well, tell me about what's happened in this opportunity, right? And the data source for this is actually Salesforce, but it works with Dynamics CRM as well. But it's you can see I generated this a while back, but still, same type of thing. It's telling me exactly what's going on, high level details. Are there any open tasks related from a CRM perspective? Oh, there are. I better do this before the meeting. What happened in that email thread between the sales rep and Marcy leading up to the conversation? And then this one could be really interesting. Are there any open cases, right? So Marcy had a customer service case because she was trying to access something and she couldn't get access to it. So she submitted a ticket on the site even, right? All of that information is essentially auto coming just from knowing what's going on with the CRM details. So using that and additional prompts like, what's new on our plan document, compare the 2024 benefits versus the 2025 benefits. I mean, that help me prepare, help me create an agenda. All of that is all part of the picture here that I think is, what would have happened? Would you have
Yeah.
used something like this? Which elements do you think that you would have used most?
Honestly, Jeremy, this is so incredible because I'm like astounded. The reason why this is so incredible, we always talk about, as sellers in whatever organization you represent or product or whatever, as a seller, there's always this conversation about, we know we should be logging into CRMs, but sometimes CRMs just become a place to store information that you're actually not using. So then it just becomes this like busy work that we all have to do as sellers, like, oh, fill in your CRM. But the reason why this is so revolutionary is because it's utilizing that information in a way that's actually going to empower the seller. I remember as a Medicare Advantage seller, often like I mentioned earlier, when we had these seminars that we had to host all throughout whatever state you're in. So me in Michigan, I would be in this region, then I have to get in my car immediately and go to my next seminar. Well, often in between those seminars, I would have my one-on-one appointments with my prospective beneficiaries. And it would have been tremendously helpful if before going to meet that person, I could pull up my phone and get all this information, like you mentioned, to remember where the conversation left off at and what my follow-up actions items were for my last conversation. And that way, the CRM really is what it's supposed to be, a tool to help the sellers remember their conversations and provide, better customer service. I love that. That would have been so helpful. And the last thing I'll say is, in between my seminars, someone might say, oh, well, you just pull up your laptop and prepare before your meeting. Absolutely not. I don't think people understand. It is literally the busiest time of the year annual enrollment period. There were days where I went without even having time to eat food. I was like be jittery off of caffeine. I didn't have time to eat food. You rarely even have time to go to use the restroom. And I'm sorry, but that's the reality. And so the idea that after your seminar, you're going to have time to pull up your laptop and casually read all your notes and prep for your meeting, that's not a reality if you work in this space. Because right after your seminar, everyone that's there is going to ask you very complicated, specific, nuanced questions about their personal health care and how it relates to your plan. And so suddenly now you're left with 1 minute to go from answering all those questions to get into your car to go to your next appointment. And so if I had the ability to use my phone when I got to my customer's house to go over those important details, it would be a game changer. It really would. And again, it would make me feel like I'm more impactful and less stressed of, running around like a crazy person. So this is amazing. This is a game changer.
Ashley, that is spot on. And it's interesting because it seems since your last time in there, that hasn't changed too often in the industry, right? Because I speak to a lot of my customers, right? And they talk about that lack of personalization, like you're saying, the ability to be able to prep in between that time is just not realistic. And what tends to happen is you start to orient yourself towards generic messaging, right? One size fits all message that is easy for you to remember as the seller, so that you can still stay on top of all that other information as it as it relates to the intricacies of the plan details and this plan, not only the plans you have, but other competing high-end plans that I think you're getting more of those consistent questions around. And so being able to your point, not only prep for this, but pull in that data to see where were we in those last conversations, what was the impact of what we had, was there issues that stemmed in between the last interaction that we had and this next one we're going to have, so that I can come into it from a different lens of, hey, maybe I'm speaking to the problem. I know you had that one associated problem where you're able to get that fixed. Like just that level of humility really can change the way that the members are looking at the agents that are providing these services,
and
right?
people remember that too. Like,
Mhm.
let's be clear. They remember how you interacted with them. And if they experience you as you're just here to get me to sign up and you're going to go to the next
Mhm.
person, they're going to get turned away from that. The plan that I represented, we were a regional plan. And one of the reasons why we were so strong is because we could have that touch, that personalized touch, like you were mentioning, where we let people know, like, hey, we care about you, like we're here. But that's only going to be more challenging with all the changes that we mentioned earlier from CMS. And so the reality is that Medicare Advantage sellers, they have a huge task in front of them and they don't have the tools. This becomes a matter of not should we incorporate the right technology. We know we need to do that. It's just a matter of when are we going to do that? And if we truly care about these sellers and we want, these prospective beneficiaries to feel heard and cared and seen, then it becomes imperative to give these sellers the right tools like Copilot to do their job more effectively.
Yeah, actually, a few things that you said made me think about things. So, I used to have to spend a lot of time on the road earlier in my career,
Mm-hmm.
and you talking about going to a seminar, like I imagine there were probably times where you had a downtime, right, where
Mm-hmm.
you couldn't be, maybe interacting with or doing your prep anyways,
Yeah.
right?
Yeah.
So one thing that I think is really cool about this is that again, this type of experience is available on mobile, and you
Mm-hmm.
can have that chat with Copilot. Like, imagine you had like the smartest intern ever, and they were just there, and you could call them up and say, "Hey, I'm driving. I'm in the car. I'm not at my computer right now. Can you help me get ready for this meeting?"
Mhm.
Well, you can do that now, right? And
Oh my
so,
gosh.
yeah, it's
Jeremy,
awesome.
where
Yeah.
were you when I was in this
Oh,
role?
well, Copilot didn't exist at the
I know.
time. Sorry. That was pre-Gen AI. I mean, AI was there, but it wasn't this kind of AI.
Yeah. Oh my goodness. This is
Just
awesome.
to give you an idea, though, I mean, a simple prompt like help me prepare for a meeting, right? In here, what it's doing now is it's saying, okay, well, I know a lot of different things. I know all about what's going on from a CRM perspective. And I pulled that in too. And these are the types of things that you need to do to get ready for this meeting. So especially in this case, this is actually pulling from a email. We see that email being referenced here, but the customer said, "Hey, I'm looking at your plan and somebody else's plan. Can you recap what the differences are during this meeting?" I said, "All right, well, cool, great. Well, help me get ready, create that prep doc, tell me what's going on, all the CRM information, how to compare, all the prep tasks." And then I said, "Well, what's the pros and cons? So maybe they're evaluating Humana's plan. So what are those pros and cons of their plan? I'm not sure. It's a new plan year. Everything's different all the time. Well, what if they don't have or good international coverage at all? Or what if their international coverage options are really expensive? This person's about to retire, right?
Mm-hmm.
Are they going to be
Mm-hmm.
doing some traveling while they retire? Maybe we should ask them. Now, all of a
Mm-hmm.
sudden, we've got really cool information. And because this is available on mobile, I mean, everybody knows how to do, well, I think everybody knows how to do voice to text on a mobile device. So that's there too. And then one other thing I want to quickly think about is what that experience looks like from an email perspective. So we've talked a little bit about that Copilot and Outlook, and this again is also available on your mobile device to help you, draft emails, get this out the door, summarize what's going on. But the thing that we can do when we bring in the CRM information into this is super, super cool. So we're able to then say, all right, well, we're going to add some sales information and guidance. So it's specifically looking like for things like budget, authority, need, timeline, things like are there changes in contract effective dates or, when they're looking to make their decision by. Here's that competitive intel kind of being mentioned again, that there's somebody looking at not just your plan, but another plan. You better be ready for that. And this is the opportunity that it relates to. And so I think that that's pretty cool. But the ability to as well get to the CRM data without having to flip flop back and forth between browser screens and make sure that you're logged in or go between mobile apps and get frustrated potentially with the view or the layout of your mobile app. Well, all of this is here too. I mean, being able to say, we know what's going on. Here's what you've been talking to your customer about. Here's all of the information related to this email thread and the CRM records. Do you need to go ahead and add Marcy's husband, Bruce, into CRM as a contact while you're at it? He's turning 65 next year. And then, really being able to slice and dice all of this information and update CRM, review CRM, get generative AI to tell you what happened in CRM without going there. So this, I think, for sellers, I mean, I would imagine that a combination of this natural language, just I'm chatting with my assistant. My assistant's helping me get ready for this meeting. And then I don't have to worry about where I'm working anymore. All of the data is all in one place. I mean, tell me what you think about these concepts.
That's so amazing. That literally would just make anybody's job in that role specifically way less stressful. And another note though to add with all this is there's also that overarching cloud of am I being compliant that you're always thinking about because there's all these different rules. And so being able to have this all here in a way that I know it's connected to the right things, it can remind me of things like you mentioned, like is their birthday coming up? Because there's different rules about that and how you can interact with them based on when they need to enroll. All that information is hard to remember when you're talking about 2x 10x rather customers that you're talking to that particular day. And so having that all there, oh my goodness, like that's just it's a lifeline. It really is a lifeline. Like there's no other way to describe it. It will be so useful.
Yeah. And I know we're almost at our time, but Fajiro, I wanted to talk to you about this because I know that we've talked to some payer customers who are saying, well, this is great and this is a huge part of what sales is, but they're also evaluating their digital strategy, right? So what does that sales experience look, from online perspective? How do they support that? How do they use that from inbound leads? So one of the things that we can do is, besides this assistance to help your brokers, your agents, your internal folks, how do we then use this same type of technology and put this into the hands of your members or prospects? I mean, of course, I'm sure people are thinking of use cases right off the top of their head from a customer service perspective, but what about selling, right? So what I did is I said, I'm going to use the same type of technology that we're using throughout the M365 Copilot and the Sales Copilot, and I'm going to turn this into a customer-facing experience. And again, not to pick on anybody in particular, but I just was able to source information from a Blue Cross website in order to build this. But what if I could then say to this Copilot assistance, how does your Medicare Advantage plan compare to other plans? Similar, right? Well, now this Copilot can source all of the content that is part of those data sources and bring that information back and help that prospective member get to that information, right? It's providing a direct source to this Blue Cross's website that helps them understand, what services are potentially covered. This is just a super simple example, but I could also say things like, my English isn't so great. Can you translate that to Spanish? And because it's built on an LLM, LLMs already know about Spanish, right? So you don't have to train this. Like the out-of-the-box setup to do this was like 60 seconds, right? And then I could deploy that on a website. Of course, I continue to make it my own, and then I can do things how do I enroll for coverage? And what this is doing is that I actually used Copilot to build this essentially integrated lead collection mechanism into it. And it said, all right, great, I can help collect this and turn this into structured data and then bring these leads inbound to you. So this is something as well that, I know that we've had some conversations with our customers about how this is going to be a big part of it, either from bringing in more leads, and eventually, I mean, the future could be that a big part of new members enroll completely through a web experience.
This thing, it's a game changer. It's a game changer. I know from the customers we've shown this, Jeremy, that this has been an eye-opening experience, right? Really understanding, I think, taking antiquated processes and reimagining them in ways that I think we're just now scratching the surface of those capabilities, right?
Yeah. Yeah. I mean, I heard somebody say on the call the other day that right now, generative AI is the dumbest it will ever be. I mean, and if it's the dumbest it will ever be right now, and it can do all of
Oh,
this, I mean, the future that is ahead is just incredible. And, like I said, this was something that just this was 60 to 90 seconds worth of build. And I said, here's the things that you know about. And then I was able to come in and add a topic. And you can use Copilot, so you can use natural language, and it builds all these other kind of conversation extensions for you. And it, based off of a single sentence, it built out utterance examples to say, like, all right, when people are talking about orders or enrollment, we know that we need to start collecting some information. And it automatically built in all of these threads for me, and I just had to ship it.
I
And
love
then
how
this can be
intuitive it
anywhere.
all is.
it's
Yeah.
It's
just so
so intuitive.
seamless,
Yeah.
and it's crazy to think about what used to go into crafting these experiences before, right? When we think about how intensive it would be, how they would have to hire linguists that are thinking of how do humans naturally go line by line? What are the ways that they say it so that you hit the point and that note exactly so you can get the output you're looking for, to see it, to your point, 60, 90 seconds, populate not only a chatbot experience that is multilingual and has the ability to go through various topics, collect data, and turn it into lead generation. It's unbelievable. It's unheard of, I think. And Copilot's really changing the game for our payers here with these kind of experiences.
This, in the past, this would have been like a six-figure, multi-month project to do things that we can do in, minutes now. It's the rate of adoption, I think, for these types of tools is going to be so quick. Of course, there's things that people want to address, right? The great news is that this is something that, if you were to ask it about something completely irrelevant besides the data sources it's trained on, it can say, sorry, I don't know about what's on the McDonald's dollar menu. Are you interested in a Medicare Advantage plan? So some of those safeguards are pre-built in, but they, of course, can be adjusted. And you can also bring in your custom AI and machine learning models and pump that into the process too. So if you wanted to be able to give, like, maybe, I don't know if this is how it worked, but if you wanted to reference some ballpark quote information, or if you wanted to turn this instead into a customer service bot to tell the member, like, member said, hey, I just don't understand why I got a bill. And then sources all your EOB information, authenticates the member experience, and says, well, here, this is why you got a bill, because here's your explanation of benefits details. Guess what? Copilot actually already knows about EOBs. It doesn't know about your patient's EOB because it doesn't have that, but it knows what EOB is, it knows what those forms look like, and it knows how to understand and explain it already. It's nuts. So I know we could probably talk about all of this for all day. I know I could, but probably a good place to put a pin in it. But thank you so much. I know Chad had to drop early. Thank you, Chad. Thank you, Ashley. And thank you for Jiro. And we'll get this up on the web soon here.
Looking forward to it.
Thank
Looking
you.
forward
Bye,
to sharing.
everyone.
Thanks, everyone.
All right. Thanks. All right. Bye-bye.